dear chairmen, dear international guests, dear colleagues. First of all, I would like to thank you to the organizer that invite us for this year, this wonderful meeting about the surgery, the spring meeting in Russe. After that, I would like to apologize that all of my slides are Bulgarian language, but I didn't know that should be in English. Sorry about that. I'm going to speak about one interesting and probably very high level of technologies in surgery, the telementoring for robotic surgery. What is the challenging and possibilities of these technologies? This is the factors that can change the surgical education, the fast growing of minimal invasive and robotic surgery, how can we speed up the training skills of the young surgeons, and how the telemedicine can create the new models of expertise and new skills, and how the telementoring can help us in the distinct learning in real time. This is the different the distinct forming of surgery. The telementoring is the first one. This is the approach that some expert is far away from the operator and through the special software can doing the real-time consulting and mentoring of the procedure. It's need video control networks in real time, but the expert cannot move the instruments on the robotic console. Telepresence, the telepresence is just the virtual appearance of audiovisual system in the operating theaters, and you can watch and communicate with the team. Some of the surgeons internationally in USA use this telepresence for the checking of the situation in the operating theaters. Is the patient are ready for the new operation? What is teleproctoring? Teleproctoring is expert, high-level expert who can be doing the accreditation and evaluation of the surgeon during the procedure. It's these techniques and this approach are using for the credentialing of the surgical wards, surgical operating theaters, or some specific procedure without possibilities for the invasion in the operating theater also. And telesurgery when the surgeon can doing the manipulation with the robotic system far away from the operating theater. We have a lot of evidence base in the last 2 years that some surgeons use this kind of telesurgery, and with the new systems, it's absolutely possible for doing it using by internet connection. The mentor, it means teaching, the presence, the proctor can evaluate, and telesurgery can the surgeon operate. What is telementoring? This is distal navigation of surgeon in real time using by internet connection. You can using the video, audio control, and to share the imaging during the procedure in real time without any linking. When the expert watch the operation, can doing the mentoring of the console surgeon and help the team, intraoperative team, for the decisions and change the strategy during the procedure. What is telestration? Telestration, when we have also possibilities to doing the mark inside of the console video of the console surgeon, and help the inexperienced or moderate experienced surgeon to take the right decision. What is need for telementoring? High quality of video connection, low latency of the connection, camera in operating theaters, special software for communication, and systems of telestration also. What is the challenging and ethics about these techniques? Who is the responsibility of procedure? Who is responsible for the complication that appears in the operating theater? licensing in different and ethics in different countries. How can we save the personal data of the patient, and what will happen if the internet connection will lose. With the 5G and 6G, it's absolutely possible for doing the telesurgery and telementoring, of course. Integration with artificial intelligence also is possible, and augmented reality also is possible with, in that way, for consultation in real time in surgery. And this is probably one of the good solutions for global education of the surgeons in the new era. Right now, I would like to share with you one short video from our experience. How can we use telementoring using by Proximie software, is the UK software. Breaking barriers in colorectal robotic surgery. This is the first transcontinental telementoring IP resection of the patient with ectopic left kidney in the pelvic area. You can see the left kidney. The connection is from Chongqing, China. It's far away, 7,500 kilometers far away from Bulgaria, and probably the internet connection is more than 11,000 kilometers far away. This is the initial steps of the surgery. Unfortunately, we don't have an audio. I was in China because of a business trip. I'm the rector of Medical University Pleven in Bulgaria, and my colleagues in Bulgaria here was in trouble because of this kidney in the pelvic, and we decided to use the Proximie software for the real consultation of the operation. On the console in the operating theater is my team, Associate Professor Karamanliev, and Dr. Shoshkova is the patient side surgeon. Me and one of my colleagues from St. Marina Hospital from the team of Professor Golchev and Tomov was behind me and for the consultation. The tricky here and the difficulties here was which plan is appropriate for divide the mesorectal plan and the left kidney. Here you can see the left kidney in the deep of the pelvic area, and the anatomy of the patient was really different than the usual one. At first, we discussed with Associate Professor Karamanliev what will be our choice for initial mobilization, and if I have to be honest, the connection was pretty good without any lag, and we have very clearly discussed in real time without any seconds, less than half the second lag. And it was very challenging for us because in the same time as I am traveling in the dead bus near to Chongqing, China, the connection was really good. The 5G in China is absolutely better than the European ones. And I believe that this helped us in that situation a lot. On several times for the 2 hours connection, we changed the strategy, and we discussed about the different possibilities about it. And based of practical skills and practical experience of Dr. Karamanliev and based of my mentoring to him, we have done very good quality of the surgery using by Da Vinci system. And we divide the plane between the mesocolon and mesorectum and the left kidney without any injuries of the kidney, without any complication. It's very important for such kind of telementoring softwares to have a good internet connection, of course, and to do not have lags of the signal. If you imagine during the football match, if you look real time the video signal, but the sports comments will be appears with 2-3 seconds late. Everything will be very funny and not so helpful for you to realize what happened on the match. Here is absolutely the same. All the time during the procedure, I had very good internet connection. Just 2 or 3 times for less than seconds, I lose the control with my operating theater and with my team, and it's not it's not so bad as the possibilities. Up to the moment, we have several such a kind connection far away from Bulgaria, from Italy, from Greece, from Romania, from Dubai, and this is the highest as a difference as the kilometers, more than 7,500 kilometers. I will doing the follow-up a little bit.
Основа, не така, както по принцип не си
Може да чуете вече.
да е за широка площ. Марти, трябва да следваш план. Да прескачаш етапи сега. Трябва просто да го следваш. Влям.
In that moment, we realized that the left kidney is here. The mesorectum was wider as the usual and was very narrow space between them. This is the part of the left kidney here. This is the mesorectal fascia, and this is the presical fascia here. This is the right common artery.
Долу.
Където
Е там, там долу. Да.
Right now we change the strategy a little bit with few centimeters.
Лявата ръка малко повече. Малко си повече. Сега си взе плана в момента. Оп, ето го плана точно в тебе.
The interesting is that in the beginning we think that we're doing the usual daily approach with such a kind of consultation, but after the checking of the scientific reference journals and international websites, we realized that this is the first transcontinental colorectal telementoring surgery consultation. This is the left kidney here. I was happy there because during the surgery everything was correct with really high quality of the signal, but my troubles has started 1.5 hour later because probably the Chinese government realized that my mobile did the transfer over 3 gigabits, 3 megabits internet connection, and my mobile stopped for 2 or 3 hours after the connection.
I think that is the best example of telementoring from so long distance, but you know it's probably a time to prepare for some kind of end of this presentation because the time is up front.
Everything with the patient was okay. We have done the operation, and 5 days after the surgery, the patient was discharged from the hospital. Thank you so much for your attention.